Hi, this is Dr.RUkmani Choudhary and you are watching Dr.RUkmani's Health Update. My today's topic is GERD, Gastroesophageal Reflux Disease. So in this video, all about GERD, that is, gastroesophageal reflux disease. What are the causes, risk factors, sign or symptom, required test, prevention, how we can prevent this condition, best homeopathic treatment. I'll be talking about allopathic treatment. You are requested to watch complete video for complete information. That's GERD. See, as the name suggests, GERD. G for gastroesophageal reflux disease means you have acid reflux. So this is a kind of disease in which you have acid reflux, regurgitation of food on frequent basis. It have heartburn. Heartburn is a different heartburn is the symptom of disease. So heartburn is the common burning sensation in your chest, and if it is frequent basis means if you're having regurgitation of food and that too with a frequent basis, then it is called GERD. What are the causes, how it happens, how it develops? See what happens, this is your esophagus, means your food pipe, and food goes down in your stomach, right? And there's a sphincter at the lower end of esophagus, and that controls of the food. So once your food goes down in the stomach, then it closes so that the food cannot come to the esophagus backward. So it prevents the backward regurgitation of the food from stomach to food pipe, esophagus. So this inspector controls, and if this inspector, this is a must, this is a closer kind of thing. So once this loosen up, means there is a not very good control, you have poor control of your muscular sphincter, then your stomach food goes upside, means this is a regurgitation. So this is how it happens. What are the risk factors who are prone to have this condition? If immediately after having your meal, you can develop this problem. If you are overweight, you can have this problem. During pregnancy, yes, it is seen, it is quite common during pregnancy. And if you are heavy drunker, any sort of addiction like tea, coffee, soda you have on frequent basis, you can develop this problem. So have hiatal hernia. On my Hindi YouTube channel, I have a separate video on by the name of hiatus hernia. You can go out and you can check there. So if you have hiatus hernia, you can develop. These are the risk factors. You can have this problem. What are the sign or symptoms? I mean, what suffering? What are the other symptoms you have? See, this is a clear-cut indication that you are having regurgitation. First of all, you are having regurgitation of food. Means while your sphincter is loosen up and your stomach content is coming, into your food pipe and in your mouth as well. So regurgitation of food. Regurgitation, there is an acid reflux. Means the stomach acid, the gastric juice upside, and you have the burning sensation, that is called heartburn. At times you can have vomiting, water brush, means that the water comes in your mouth. You have bitterness, bitter sour taste in your mouth. You can see where you can have cough related problem, respiratory problem, even asthma you can have. So these time difficult swallowing with the time dysphagia you can develop. Criteria for ruling out that GERD problem. So this see all your symptoms to be collected, and it is a acid reflux on the frequent basis, means more than twice in a week, then it is a diagnosis that yes, you might be having this problem, GERD. So number one is your complete symptomatic collection. Number two is your barium meal test. Barium meal test is conducted, barium given to you and you swallow, and after drinking that barium, your x-ray can be done. So exact images, picture, esophageal images. The next one is endoscopy. Endoscopy is the advanced one, can be done if you are having frequent basis symptoms, severe problem, like if you are having severe symptoms, severe problem, in that case endoscopy can be done. A thin tube can be inserted with the having tiny, can visualize properly. There is a severity, tissue sample can be taken out and can be studied for the further abnormal. If there esophageal manometry and esophageal monitoring can be done to exact your esophageal muscles are working. For the prevention part, I have discussed in the risk factors that if you focus on risk factors, mean what are the factors that is aggravating, that is causing your problem. So if you focus on that, you control all your risk, easily prevent this condition. Like you have control on your weight, just watch on your like coffee, tea, any soda intake, and avoid having tobacco and alcohol. So these are the things, if you control on these things, so you can easily prevent this condition. The treatment part, See, in allopathy, yes, antacids can be given, proton pump inhibitors, S2 receptors can be given. In homeopathy, there you can use, but the medicine vary from patient to patient. Like you can have many medicine, but the symptoms vary from patient to patient. In so many medicines, but let me tell you, medicine in homeopathy always focus on individualization. Like yes, you are having gastroesophageal reflux disease, but what other symptom you are having along with that? So having Pulsatilla. See, Pulsatilla is given in GERD cases where you have your problem arises or your problem was having fatty rich food. So in that case, you can take Pulsatilla in 30 or 200, and this is oral form, and you can take with the direct with the help of drop 1 or 2 drops twice or thrice before meal. Like, and if you're watching on YouTube, I have provided link, all the medicines link on the description box, but use one medicine at a time. Iris versicolor. Iris versicolor is given when you have GERD, but you are intent to vomiting, means you are having vomiting, you have bitterness in your mouth, and you are fluid vomiting you have in Iris versicolor. So in that case, you can use this medicine. Then Carboveg, you heard about Carboveg, a very common medicine given blindly given in the cases like any gastric problem. But Carboveg works wonder when you have any after drinking, after having meal, you feel always bloated up, means your tummy is always bloated. So in that case, you can use Carboveg, very effective medicine in 30 or 200 potency, 1 or 2 drops twice or thrice. Phosphorus is again very good medicine in homeopathy for GERD, in which you have any voice problem, means you have hoarseness of voice, you are having, along with that you are having voice issues. So in that case, you can use phosphorus, very good medicine. You can Somica, again very common, blindly given, almost specific patients, when you have abuse of alcohol, excess use of alcohol, overuse of alcohol, and Nux vomica have the gastric cough, you are having gastric problem, you are having respiratory problem. In that case, you can use Nux vomica, very good, 30 or 200 potency, 2 drops. Other medicine like arsenicum albumin is given when you have burning problem and vomiting, and phosphorus is given when you have dysphagia problem, you have difficult swallowing. In that case, you can use natrum phos. Robinia tops the chart. Robinia is given when you have night problem, you are having regurgitation of food during night. So in that case, you can use Robinia. Let's see, I'm having 3 medicines. Like these are the specific medicine you can say, but use one medicine at a time. This is in the draw form R5, so you can use this medicine like 10 or 15 drops in some lukewarm water twice or thrice before meal. If you are using this medicine, you don't have to use other medicine. Why? Because this is having very good combination in it, so you can use this medicine only. Now I'm having digester tonic. If you are comfortable with the tonic or syrup, you can use this tonic, very good, by the name of digester tonic, very good, very effective. And if you are comfortable with the tablet form, in that case, you can use Nixocid tablet, it is very good. This picture is also indicate this 2 tablets twice or thrice before meal. So these are the medicine. There are other medicine as try to focus on your case, try to use single medicine, minimum dose. Hopefully this video can help you. If you find this video knowledgeable, informative, please like, share, and don't forget to subscribe my channel, press the bell icon to get notified the videos in for the further and detailed information. Thank you for watching, thank you for your support, thank you so much.